This is Michael from First Aid Oz, and we're looking at burns. Now there's all types of different burns. There are burns of obviously the skin, most commonly would be sunburn, or you've touched a hot object, or you've spilt some hot fluid on your hands or on your arms or on your legs or wherever they may be. But you might have spilt a hot bowl of soup in your lap on the couch. All those type of things are not uncommon. But then there's other type of burns which may involve chemicals, or you've breathed in some substance or some gases that are burning your airways. So obviously some of those are more serious than others. We need to also consider the amount or the magnitude of the burn, whether it's just a skin burn or whether it's penetrated through several layers of skin, or whether in the case of a third-degree burn it's gone right through past the nerve layer to even the muscle. So the first thing, as with all first aid situations, is you follow your doctor's ABCD protocol. You know, when we're talking about burns, you want to make sure that you're not also in danger yourself of being burnt by the same gases or the same substances or the same liquids that cause that burn. Where it's safe to proceed, we're going to assume in many of the cases the person is conscious. So in terms of a response, we would probably get one, and we'll probably, with the exception of third-degree burn, sometimes when there's damage to the nervous layer, the person will be in considerable amount of pain. If you suspect there is a burn to the airways, you need to call 000. Very, very important, because it can be something that's corrosive, it can be something that may cause the person to stop breathing, and then of course you're going to require to do CPR and so forth. So we need to get that ambulance there as quickly as possible. But let's look primarily at your more common burns, or your household burns if you like, which are usually your first degree burns. So maybe you've touched something hot, or you've spilt something hot on yourself. In that case, what we generally do is we would run the area under cool flowing water. So if I had my casualty come forward with their burnt hand, so for example, and they've burnt their hand, so we get a nice cold tap, okay, and we're going to leave that for 20 minutes. All right, sounds like a long time. All right, we don't apply ice. Okay, we're not trying to freeze the area. We're just trying to relieve some of the pain and also cool down the area and the surrounding area. So 20 minutes under the tap. We're not going to stand here for 20 minutes, of course. Okay, so let's assume that we've done that. Okay, and then from there, very important that when we're treating a burn beyond that point, that is possibly going to blister. Okay, so we don't want to put any sticky layer of bandage on it. We don't want anything that we're going to pull off later and it's going to take the skin off, which then exposes the site to infection, as well as being painful, but also can leave some scarring. So if you've got some Glad wrap, okay, or some shrink wrap, would wrap that around there, okay, which again is non-stick, or if you've got some light non-stick material, gauze, that you can apply to that area. It doesn't have to be applied firmly, okay, but that's primarily to prevent it from infection. Very important that when you get blisters, you don't pop your blisters, okay, you just let nature take its course, and it'll heal generally by itself. If the burn was a little bit deeper, okay, so several layers, again, non-stick dressing, don't put any creams or ointments or anything like that, run it under the cold tap, perhaps Glad wrap, and we send them off to the emergency department. Okay, so that is burns.